Our next guest will introduce iDose TR. This is a revolutionary treatment for glaucoma. From NVision Eye Care Centers, we welcome Dr. Raouf.
Thank you, Bree. Thanks for having me.
Thank you so much for coming on the show today. We've got some exciting things to talk about, but I want to get back to the basics before we start telling everybody about this fantastic new treatment. Dr. Raouf, tell us a little bit about yourself.
Thank you.
What's your background?
Thank you. I'm a cataract, LASIK, and cornea specialist. So I'm an ophthalmologist with subspecialty training in those surgeries. I have two locations, Newport Beach and Laguna Hills. My Laguna Hills office is just across the street from Laguna Woods. And I primarily do cataract surgery and refractive surgery, which includes things like LASIK and PRK, basically procedures to correct the vision.
Okay.
Most of my cataract surgeries are very coupled with technologically advanced techniques, like I use the femtosecond laser, which is a laser way of doing cataract surgery, and I use multifocal lens implants, which are lens implants that allow people not to wear glasses after surgery.
Wonderful. That's fantastic.
Thank you.
For those, including myself, that don't know, what is glaucoma?
Glaucoma is unfortunately, a very common disease that in ophthalmology, we call it the silent blinding disease.
Really?
So kind of like how hypertension or high blood pressure is called the silent killer.
Yes.
Because a lot of times when people have elevated blood pressure, they can't tell. Their blood pressure is high, and then it's just found at a doctor's visit that their blood pressure is elevated. Eye pressure is similar to that. People don't have any symptoms, and when they come in for an eye exam, their eye pressure is checked, and that's when we diagnose glaucoma. So typically, glaucoma is elevation in eye pressure, which leads to loss of peripheral vision.
Really? So that's not something that is noticeable on the front of the eye.
Correct.
It's actually, you have to look
correct
from behind.
Inside, yeah. That elevation in the eye pressure, over time, it causes the optic nerve to get thinner. The optic nerve is the nerve in the back of the eye that connects all the eyeball signal to the brain. And damage to that optic nerve is the definition of glaucoma. And that is unfortunately irreversible. So once somebody gets that thinning or damage to the optic nerve, we cannot reverse the vision loss that comes with it. And that's why it is so important to raise awareness about glaucoma, because you have no symptoms and it's a blinding disease.
Are there any preventative measures?
So traditionally, the way that we treat glaucoma is by lowering the pressure of the eye. So if we lower the pressure of the eye, we know that we can prevent or slow down that damage to the optic nerve. And in the past, when we diagnosed glaucoma, the first thing that we did was put the patient on eye drops. And we have a variety of eye drops that are available, but unfortunately, all those eye drops have side effects.
Oh.
So they cause redness of the eye dryness, irritation, burning. The most commonly used eye drop for glaucoma that we use as a first line causes loss of the fat around the eyes. So when I'm meeting a new patient and I walk into their room and I know they have glaucoma, they've been on drops for a long time, I can tell without looking at their chart, because they have this sunken, hollow eye appearance. They've lost all the fat around the eye and their eyes just look sunken. Wow. And that's a side effect from the eye drops, unfortunately. So iDose is a new treatment that was recently FDA approved for glaucoma that is going to allow us to lower eye pressure without depending on those eye drops. And that's why it's such a revolutionary change in the way that we treat glaucoma.
Tell me about this. This is so interesting.
So we want to be more proactive in treating glaucoma. And instead of throwing eye drops or adding more and more eye drops to their regimen to lower their eye pressure, Instead, we are now able to allow these patients to be eye drop free without all of these side effects with a very simple procedure that's called iDose. iDose is a very tiny implant that is made of a material that is both biocompatible and inert. So there's no inflammation, there's no reaction inside the eyeball from having it in there. And it releases the eye drop in a very concentrated way over the course of years. So it slowly releases that eye drop inside the eye.
But how big is this device? It can't be very big.
It is very tiny. In one of my slides later, I'll show you a picture of what it looks like. It is so small, patients can't see it, can't feel it. It's just inserted inside the eye with a microscopic procedure.
But yet it has eye drops.
Correct. So they were able to concentrate this eye drop to such a high degree and change the formulation so that it slowly elutes this eye drop over the course of years without causing any of those side effects on the outside of the eye. This slide over here shows what the device looks like. It's really, really tiny. The medicine in it is that tiny little gray ball in the center of the screen.
Okay.
The rest is just the device that is able to anchor this eye drop into the front part of the eye. So it's all internal, and the location in which I anchor this device is in the inside of the eye and close to the part of the eye that controls the circulation of fluid. And that's how it's able to lower it. Look at the size of this eye drop here to the right. That is a pretty big size eye drop. It just comes from a regular sized eyedropper.
Okay.
And next to it, you see a comparison of how tiny this device is compared to the size of an eye drop. In reality, the actual size is less than 2 millimeters. It's really tiny.
And so, Dr. Rove, does that go sort of in the front of the eye?
Correct,
or is it,
but internally.
Internally.
Correct.
So you mentioned you can't feel it.
No, you can't feel it, you can't see it. The incision to insert it into the eye is so small. It's the size of the incision that we do for cataract surgery. The procedure takes 5 minutes. I do it in the operating room under twilight anesthesia, so the patients don't have any pain during the procedure. Afterwards, for a couple of days, they might have a little bit of foreign body sensation from the incision, maybe a little bit of swelling or inflammation. We put them on a short regimen of eye drops to help with the healing.
Sure.
After implanting this device, over 80% of patients that get this device are eye drop free. They no longer have to use eye drops. And one more fact about this is that the pressure of patients who have this device is actually lower than the pressure of the patients that use eye drops every day.
Is that correct? How long has this technology been around?
So it just got FDA approved in the past few months. And we are one of the first practices that is offering it. We're really excited.
It's extremely exciting.
Yeah.
And to not have to carry around a bottle of eye drops.
Yeah.
Constantly.
We as ophthalmologists, we see lots of glaucoma, we treat lots of glaucoma, and it's really a devastating condition. I have patients who have to do 5, 6, or 7 different eye drops every day. It basically takes over their lives. They have a schedule, they have an app with timers, they do sheets, and they have to stay on top of that schedule so that they don't lose their vision. So this has been so excited because we're able to get these patients off these drops, not just better eye pressure control, but also less red eyes, less burning, less irritation, less side effects to the surface.
Does that help with a condition called dry eye also?
Absolutely.
You mentioned
Absolutely.
that earlier in the
Almost
slides.
every glaucoma patient that uses eye drops also has dry eye. Unfortunately, all of these glaucoma eye drops have preservatives in them. There are some preservative-free formulations that have been developed over the years that work great, but a lot of insurances don't cover them. Mm-hmm. So patients, unfortunately, tend to suffer from dry eye, which is, as most people know, is just a very difficult condition to deal with.
Right. And so does insurance cover the iDose?
It does.
It does.
Yeah. So as the procedure is being rolled out and it's FDA approved, more and more surgeons across the country are doing it. Just like with any new procedure, in the beginning, only a small number of insurances cover it, but as more surgeons perform it, as more patients ask for it, more and more insurances will start covering it.
Wonderful. Okay. All right, folks. Well, you heard it from Dr. Rove. You can find her here in Laguna Hills and in Newport Beach. Doctor, thank you so much for coming.
Thank you.
This is such valuable information.
Thank you.
Really appreciate it. Coming up next, we've got Deluxe Nightclub. So we're going to kick it up a little bit around here. Stay with us.